Hello everyone, thank you for joining us today for this PIN webinar which is focused on good work and mental health in a post-COVID era. This is one of a series of webinars from the Productivity Insights Network, all of which explore a range of issues affecting productivity in the post-COVID-19 era. My name is Dr. Katie Jones and I'm a senior researcher at the Centre for Decent Work and Productivity at Manchester Metropolitan University's Business School, and I will be with you chairing today's session. Before I go on to introduce our speakers and the panel though, I would like to briefly tell you a little bit about the Productivity Insights Network. So it's a network funded by the ESRC. PIN is an interdisciplinary team of researchers from across social sciences exploring the broad range of issues affecting productivity. As a capacity building network, PIN engages with academics and intermediaries from other organisations and is led by Professor Philip McCann at the University of Sheffield and Professor Tim Borley at Oxford Brookes University. The session today is led by Dr. Daniel Kopasker from the Health Economics Research Unit at the University of Aberdeen. He is an applied econometrician whose work focuses on the intersection of health and labour economics. Joining Daniel is Fabian Wallace-Stephens, a senior researcher at the RSA's Economy, Enterprise and Manufacturing team, and he is also part of the RSA Future Work Centre research team. His research interests include self-employment, the gig economy and the impacts of technology on jobs. Please do take the time to have a look at the PIN website, and here you'll find Daniel's report, Insecure Employment and Mental Health, One Pathway in the Productivity Puzzle, which is an excellent read if you have not read it already. And also if you are interested in a related topic on how our welfare system supports low-income workers, our report on universal credit and in-work conditionality is also up there too. For more details about future PIN webinars, please visit the Productivity Insights Network website or keep an eye on PIN's Twitter page, and do feel free to tweet along with the webinar today if there are any Twitterers amongst us. We will be taking questions at the end of the session, so you can type them into the text box that should be on your screens. If you see questions that people have already asked and you wish you'd ask them and you'd like to make sure that we cover them in the discussion, you can actually click on that and it will indicate that there's interest from the audience in a particular question. So a little bit of a voting system at play there. So please note that today's session is being recorded, but if there's an option to ask questions anonymously if you're feeling a bit shy. So without further ado, I am now going to hand over to Daniel.
Okay, thank you. I'll just share my screen. Is that okay? Yeah. So I'm going to talk now about the interactions between the economic and mental health challenges of the COVID-19 crisis, and in particular how the policy response, a policy response based upon job quality would address some of these challenges. So already there's evidence emerging of the severe effect on mental health of the COVID-19 crisis. The Institute for Fiscal Studies recently produced a report, and in that they show that the average decline in mental health across the UK population is 8.1%. And these effects are larger for some groups, particularly young adults and females. And as the economic crisis resulting from the COVID-19 challenges emerges, there's likely to be further impacts on mental health, both from people that experience volatility in their income or their employment, but also those that fear that they may experience volatility in their income or employment. So some of the key stressors that are influencing mental health outcomes at the moment have been tracked by a study from UCL, where they take weekly data from a sample. And you can see here that the main concern of respondents within that survey is still about contracting COVID-19 itself. But beyond that, the two main concerns relate to economic impacts, and we have the blue line here, the second line. This is the second main stressor influencing mental health outcomes at the moment, and this is concerns that individuals have about their financial situation. Then the purple line below that is concerns about unemployment. Now, the concerns about unemployment have remained largely stable throughout the crisis. And then the last stressor is concerns about acquiring food. So we know that recessions have a negative impact on mental health. It's one of the most consistent findings on the health impacts of recessions. And during the 2008 financial crisis, the strongest effects on health were within mental health. And these effects persisted over time, which suggests that although the policy response may have had some impact on employment, it didn't have an impact on mental health, and this may well have been due to ongoing concerns about volatility in income or employment. So job quality really does matter to the response, and how effective that response is in addressing mental health issues. And these mental health issues have productivity impacts in the long term too. Now, estimates at the moment of the COVID-19 recession, if it had similar effects to the 2008 financial crisis, the prediction is that a further 500,000 people will suffer from poor mental health. Now, where these effects are likely to be experienced, we can look at the economic impact of a potential recession. So here we have a graph that shows the expected change in earnings for various groups. Now, we have age groups, and as the blue colours get darker, that's increasing age. And at the top, we have the size of the employer. So the smallest employers, those with less than 100 employees, are at the left-hand side, and then increase in employer size as we move along. So what we see here first is that there's likely to be a universal impact. The predictions are that across all age groups and all employers, there will be some decrease in earnings due to the economic effects of the COVID-19 crisis. But again, it is the youngest groups that are more severely affected, and particularly the youngest groups within the smaller employers. So it's not just those that will experience the volatility in income and employment. Those that experience a fear of volatility in income and employment will also incur damage to their mental health. And the individuals that experience this fear, it's not restricted to people in non-standard work or people in low income, because this is a fear of something in the future. It's a subjective effect, but it still has an impact on mental health. And this is regardless of whether unemployment or income loss is experienced in the following periods. So addressing economic insecurity within the workforce is one of the main challenges of the economic crisis. Now, the current levels of financial insecurity within the workforce are very similar to those at the start of the 2008 financial crisis. This graph shows three different forms of insecurity. We have job insecurity, which is the green dotted line. We have those that experience income volatility, so quite substantial drops in income of 25% or more. That's the blue line. And then the red line is financial insecurity, so individuals that fear their financial situation will worsen. And you can see just at the end part of this graph, the grey shaded area, that between 2007 and 2008, there was an increase in the level of financial insecurity within the workforce of 10%. And the sample here, these are full-time employees on permanent contracts. This is the group within the labour force that you would expect to be the most objectively secure, but they still suffered this substantial increase in financial insecurity at the beginning of the financial crisis. And this will have had an impact on their mental health. And as with the earlier report, where the impact of mental health of the 2008 recession persisted over time, the impact of insecurity from 2008 remained at this level, this high level of around 16% for another 5 years following the crisis, which suggests that, again, the policy response in 2008 did not address economic insecurity and also did not improve mental health. And this will have had a negative impact on productivity in the period following that crisis. So job quality does matter in the response to economic challenges. Now, we know that mental health impacts on productivity. The Farmer-Stevenson review estimated that the annual cost to employers of mental health within the workforce was around 2% of GDP. And in a lot of cases, these won't have been mental health issues that were clinically significant, but they remain economically significant. In many cases, this is individuals that continue to attend work despite poorer mental health, so what's often referred to as presenteeism. So addressing even these relatively small changes in mental health within the workforce is very important. And the good work agenda, the good work debate that's been ongoing, offers some insights into how this mental health can be improved within the workforce. So in the Productivity Insights Network report that Katie referred to at the beginning, with my colleague Katia Montagna, we showed that temporary employment reduces labour productivity. We did this for only a UK sample of employers and employees using administrative data. And this replicates a finding from a multi-country panel from Lisi and Malo. The difference with our report, Lisi and Malo found that the changes in labour productivity due to temporary employment varied by skill level. We didn't necessarily find that result, but we did find that the impact of temporary employment, the negative impact of temporary employment on labour productivity, is only found in the lower half of the labour productivity distribution. So it's the least productive firms that their use of temporary employment further damages their labour productivity. And it's not that insecure work has a negative impact just on the immediate sufferer. This has impact across generations. A paper by Andrew Clark has shown that children that are exposed to financial insecurity at home have worse educational and health outcomes. So the future workforce is affected by the level of job quality within the workforce. So a number of challenges. We have this interaction between the economic and the mental health outcomes, and we have job quality as a way of potentially improving those outcomes. And this was the case prior to the crisis, but what has changed now is the scale of the problem. So there's far greater need for these interventions, but the foundations of the interventions exist because of that debate that had been going on prior to the COVID-19 crisis. The government committed to a number of changes within the Good Work Plan, and also at the employer level, there have been a number of reports into mental health within the workforce, and they had identified issues that are still important. So in particular, there was a report from Business in the Community in 2019 that identified the financial well-being of the workforce as one of the main issues affecting mental health. So from the Good Work Plan, a couple of existing interventions that may address some of the current challenges. There's an ongoing consultation at the moment about increasing rights to secure hours and pay, and the Low Pay Commission have put forward a recommendation in this consultation regarding one-sided flexibility, and this would give people a right to more secure hours, more secure pay, and address issues around scheduling and the cancellation of shifts. And this is likely to improve the organisational commitment amongst the employees, and it will also improve mental health within the workforce. And then for those that aren't necessarily on these temporary employment contracts, but have been in a position for a long time, one of the main ways of addressing insecurity and improving mental health outcomes is to improve the employability of the workforce, such that if they were to suffer volatility in employment, they would have a better chance of finding equivalent employment elsewhere. And this has been shown to be one of the most effective ways of addressing these issues. And the National Retraining Scheme, which is currently being developed, could be very important in addressing some of these points. Now, beyond what's already been proposed, there could be further things that are done at the government level, because a great deal of emphasis has been put on creating flexibility within the workforce, but the employees have never really been adequately compensated for that risk burden that they take on by doing this. And it's absolutely possible to have a flexible workforce and a secure workforce if you have the adequate institutional support. And the coronavirus job retention scheme has shown what is possible, although at great expense, of course. But in other countries, there are often schemes that are similar to the coronavirus job retention scheme, but have more flexibility in that they allow individuals still to work, say, part-time or things like this, so-called short-time working policies. And these have been shown to be very effective in reducing unemployment during downturns, and they would increase security amongst the workforce. And a very good recommendation that came forward to the Scottish Government by the Advisory Group on Economic Recovery was to provide a 2-year job guarantee scheme for 16 to 25-year-olds. Now, as I showed at the start, these younger groups are the groups that are more likely to be affected by the recession and are also suffering greater mental health damage at the moment. And by having this 2-year period, this covers both the immediate crisis and the longer term effects, or well, medium term effects. So this could have substantial benefit, this sort of scheme. And it was proposed that they would have a living wage, they would have access to training, and also routes to progression. So this also improves the employability of this group if at the end of the 2-year period there was the employment relationship had to change. And then also, of course, it's not just for the government to address this. Employers have a role in terms of influencing the mental health of their own workforce. And there are many mental health policies within workplaces at the moment, but these aren't always consistent with the practices, the employment practices of the employers. So the living wage commitment has obviously been very successful, and this is one way of increasing security within the workforce, but also now the living hours commitment, where you have a minimum hours guarantee and issues around the scheduling of shifts and compensation for the cancellation of shifts will be addressed by this voluntary commitment. And this is very similar to what the Low Pay Commission have proposed in terms of the addressing one-sided flexibility. So it could be that the government legislates on this. It could also, alternatively, employers could voluntarily sign up for this living hours commitment. So in summary, there's great challenges. The economic and mental health challenges of the COVID-19 crisis have created a greater need for job quality improvements in the UK. If a recovery was to be built on low-risk jobs, then it's likely that the mental health crisis is exacerbated. This obviously has negative impacts on productivity, and these impacts may cross generations also, whereas improvements in job quality now could improve health and productivity outcomes for generations. So that's all from me, thanks, and I'll now pass over to Fabian.
Great, thanks for having me. So prior to the pandemic, the future of work was concerned with two key challenges, one of them being rising economic insecurity and the other being the impact of technology on work. But with the arrival of COVID-19, we find ourselves in the grasp of a social catastrophe. And this has created new challenges for the future of work, as well as accelerate or exacerbate old ones. And I'm going to talk a little bit about these two challenges in a bit more detail before outlining some of our most recent policy recommendations. So 0 hours contracts, gig economy platforms, self-employment jobs all grew since the last recession, and they now seem to be a mainstay of the UK labour market. Some research we conducted last year on atypical or non-standard workers, including 0 hours workers, gig economy workers, and agency workers and the like, suggests that many of them experience quite severe problems with economic security, and they also experience one-sided flexibility, which Daniel talked about both of these ideas in his presentation. So like self-employed workers, these non-standard workers experience problems with income volatility, with almost half of them reporting that their income varies from month to month, and that because of this, they sometimes have trouble meeting basic living costs. But for atypical workers, this insecurity is amplified by a lack of financial resilience. For example, when compared with self-employed workers, they are twice as likely to be concerned about debt. Some other research that we did further back showed that self-employed workers are often income poor but asset rich, meaning that they might have levels of savings that can buffer against some of this income volatility and financial shock. But this is something that atypical workers seem to lack. And prior to the debate, there was a big focus, or prior to the pandemic, there was this huge policy focus on one-sided flexibility, which the Taylor Review described as where employers seek to transfer all risk onto the shoulders of workers in ways which make people more insecure and make their lives harder to manage. Genuine two-way flexibility, on the other hand, enables people to work the way they want, when they want. And this same survey suggested that a significant proportion of non-standard workers experience one-sided flexibility, while they experience similar insecurities as the self-employed. They lack many of the benefits that might be associated with this more flexible way of working. So our survey suggested that just 34% of atypical workers feel they have freedom and control over when they start and finish work, compared to 77% self-employed people. And that, you know, for atypical workers, the levels were actually quite close to employees, and with 29% of them saying that they felt they had this kind of freedom and control. Another point that is quite important to emphasize when we talk about insecurity and one-sided flexibility is that, according to our survey, 17% of people in typical or traditional employment arrangements experience income volatility. But since this group account for the largest share of the labour market, this actually means that more than half of all workers with fluctuating earnings are in traditional employment arrangements. And one reason for this might be that they are part-time workers who are in arrangements where their contract does guarantee them some working hours, but where the individual usually works many more. So, for example, this could be a worker in retail or hospitality who's maybe contracted to work 7 or 10 hours a week, but regularly works about 25. And the Low Pay Commission has described these kind of working arrangements as short hours contracts, but notes that there's a key evidence gap in understanding their prevalence. It's not something that's registered robustly in the labour force survey, for example. And on that second challenge, on technology, the focus is often on automation, or robots replacing tasks or jobs. But our research, which includes future scenarios, looking forward to 2035, sector-specific deep dives, looking at how technology is impacting the retail sector, multiple dialogues with all sorts of different employers, as well as ethnographic site visits to an NHS hospital and to a fast food restaurant franchise. All of these inquiries consistently highlight the need to pay attention to a much broader range of impacts of technology. So if, for example, you look at how the labour market has changed over the last decade, and you look at what roles have been shrinking the most in terms of their net contribution to employment churn, the occupations that have been hit hardest are those that have been on the high street, particularly roles like retail sales assistants. Lots of these roles are filled by women. Meanwhile, we've noticed a significant growth in delivery roles and warehouse work. Both of these trends can be explained by the growth of e-commerce, which is not automation per se, but rather the digitization of business processes and the disintermediation of supply chains. It's a much more lateral way of thinking about how technology is going to impact the economy than where a lot of the debate focuses. And we're also seeing how COVID-19 is interacting with these technologies, with retail being another prime example. We've already seen a huge accelerated shift towards online services in the last few months, and I don't see that going back to normal. We've also seen in other industries such as health and education, with telemedicine and online lectures, they seem to have gone digital almost overnight. Another trend on the rise is workplace monitoring and algorithmic management. So an example of this prior to the crisis was the fact that Amazon patented wearables that gave workers a haptic shock when they would move towards the wrong item when packing parcels. And we're also seeing this kind of technology being used to enforce social distancing. For example, wearable devices on high-vis jackets that buzz when people are working too closely together on construction sites. But we're also seeing a rise in technology being used to monitor productivity and performance manage people who have been working from home. So this could be everything from software that tracks your keystrokes to heat sensors that measure how long workers stay at their desks. And on the question of automation specifically, a current piece of work that we're doing at the RSA is looking to try and explore how this will interact with the pandemic. And some of the early results of our research show that industries like hospitality, retail, and transport that have seen significant demand shocks and falls in economic output over the last few months due to COVID are also at a very high risk of automation. So it might be that in the coming years, these industries see an accelerated shift as human labour looks increasingly like a business. Is it puts a lot of jobs at risk that we might previously thought were more resilient in industries such as entertainment and tourism, for example. And in our most recent report, which is very policy focused, we essentially argued that the pandemic represents this moment of collective sacrifice. And in this moment, what we might be able to do is radically reimagine the institutions that are responsible for work and redraw their rights and responsibilities, particularly to give a much more prominent role for worker voice organisations such as trade unions in shaping how technology is adopted and what the future of the economy could look like. And the furlough scheme is a good example of more active involvement of unions in those labour market institutions. And I want to talk about a few of the key ideas from this paper now. Many of them build on similar points that Daniel was making. So the first is around lifelong learning. So as the economy evolves and technology eliminates, creates, transforms jobs, workers are going to have to find new ways of upskilling. And I've already mentioned how some of these trends could be accelerated by COVID. And we have recommended that the government look to develop a job security centre, which is inspired by Sweden's Job Security Council. And this would be able to provide targeted support to those who are at greatest risk of automation or heavily affected by the pandemic. And I guess one of the points here, which might be interesting to discuss, is there's been this commitment to a national retraining scheme, but when you look under the label, it's not like this idea of a job security centre that I've espoused. It's much more specific around workers in low-paid industries, helping them to upskill rather than something which is maybe geared towards automation or other trends. But when it comes to the jobs of the future, what jobs these people might be able to move into, some workers might be able to upskill and enter into the flashy high-tech jobs we often hear about. But the reality is that many low-paid roles are going to persist in different forms. So both care workers and delivery drivers were some of the fastest growing jobs of the last decade. And one would hope that in the aftermath of the pandemic, given their recently enshrined status as key workers, we're going to do a little bit more to improve the status of these jobs. And one way of doing this might be through personal learning accounts, which could help professionalize these roles by giving workers opportunities to build careers within them. And this policy is currently being rolled out in both France and Singapore, and it gives all workers annual training credits so they can spend on different courses that have been accredited by the government. The next element is a modern safety net. And universal basic income is often pitched as the antidote to automation. Previously, we might have dismissed this as fanciful, but it now feels much more prescient given that COVID-19 has almost overnight led to widespread, although temporary, unemployment. UBI would help build up all workers' economic security, providing them with a buffer against these kind of shocks. But it also complements the active labour market policies that I just mentioned, where it's critical for workers to actually have financial support while they take time off to retrain. So in this sense, a UBI could provide people with a springboard to reinvent themselves. But a modern safety net should also aim to create parity of esteem between employees and the growing number of self-employed workers. The pandemic has helped bring some of these issues to the surface, not least by highlighting gaps in sick pay and other protections that these workers often lack. And we've argued for portable benefits that could help plug these gaps by providing workers with a range of non-statutory benefits that can be accumulated on a pro rata basis and carried across multiple employers. And this kind of system is not meant to be some kind of forced impact, e.g. instead of reclassification, we're going to give workers a fraction of the benefits. Rather, what we're saying is that if there is evidence of management control, which is critical for the employment status classification debate, workers should also be entitled to the same protection as employees. But this system of portable benefits rather could be a way of supporting genuine self-employment. So people that are kind of out maybe clearly in that category. And the way it would be funded would be on the basis that the engager of labour pays. So sometimes this might be a gig platform if the service is mediated in that way, but if it's direct to consumer or direct to business, there would be some kind of engagers tax that goes into a pot to fund a range of different insurance or other benefit products for self-employed people. And the last idea is what we're calling a data covenant for workers. And this is a little bit like the GDPR, but it's specifically for workers and it's specifically trying to solve labour market issues. And I guess the shift in language is in case we move away from the GDPR after Brexit. So we found that there's there's quite a severe lack of clarity over what rights workers have over the GDPR, whether they can be trumped by consumers' rights, and other instances where algorithms are not being explained on the basis that they're proprietary. And there's and these have all been factors in the court cases involving Uber. And what this data covenant would do, it'd be rooted in transparency and the GDPR right to an explanation. And this is critical to determine whether some workers are employees or self-employed, particularly in the gig economy where people are managed by algorithms. What this means is that any evidence of management control, which is considered the kind of appropriate way to determine your employment status, is taken behind this algorithmic curtain. Unless we open up these black boxes, it's really difficult for regulators to see what the platforms are doing and whether the tweaks they're making when they say they're changing the way that the app works are superficial or not. Essentially what this data covenant would involve, both the development of innovative platforms that would give workers more power over their data alongside new regulations for employers. One such example of a platform is Worker Info Exchange, which former Uber driver James Farrar has now set up to provide gig workers with analytics based on the data they can access under subject access requests. They can access some, but not all of the data the platform holds at the moment, and this is one reason why there's a kind of lack of clarity. One of the reasons given for why not all the data is shared is because it might impinge on the privacy of consumers. But giving workers access to their data in this way could also help regulators and labour market enforcers in other ways. So Daniel mentioned that the Low Pay Commission recommend that workers on flexible contracts should get a right to request their usual working hours. And if data is being collected by workers themselves on their employment patterns, it could really help the way that this is enforced. And last year we ran an accelerator program and one of the cohort on that is called Workerbird, who are developing an app that does just this, which allows workers in low-paid industries to track their working lives using all of the interfaces on their smartphones. But alongside these kinds of innovations, we argue that the government should look to introduce mandatory disclosure requirements about workplace monitoring and algorithmic management technologies. And this would include guidelines on the architecture of disclosure, which would require businesses to explain what the different worker data systems are doing, exactly how they're being used, what data they are collecting on workers, where the data is being stored, and how the algorithms and other ways in which they're processing it. So those are all the points I wanted to make. Really looking forward to hearing your questions. Just to finish with a little plug for the RSA. We are always interested in exploring potential collaborations with universities, so please reach out if you found what I've been talking about interesting, or you're looking to partner with an organisation like ourselves. Two current research projects that we're working on. One I talked a little bit about already, which is exploring the interaction of COVID and technology. Another is looking at the economic security of key workers in particular. And on that project, we're working with YouGov to track their experience across the pandemic, across a series of different survey waves.
Thank you, Daniel and Fabian, for some really interesting insights and fascinating talks. I think, you know, the session is about COVID, so it's automatically timely, but I think today, in terms of when the labour market stats have quite depressingly showed that significant dip in terms of the number of hours work and in terms of the firing intentions of quite a significant proportion of employers through the Chambers of Commerce research. I'm just looking to the questions that have come up, and we haven't got any, which I am wondering if it is more of a technical issue. So if the PIN team are behind the scenes and you can see questions that I can't, then please somehow beam these over if it's within your power to do so. So whilst we're hopefully waiting for these to come in, and if you are just being a very quiet audience, but I know some of you in the audience and you're not usually very quiet, if you do have any questions, then please keep these coming through. But in the meantime, I will abuse my power of chair and ask a couple of you both. So, I mean, my research is really focused around universal credit and support for people who are out of work on a low income, and both of you there have touched on policies like the Kickstarter scheme and wider issues to do with the safety net. So I've got a couple of questions for you on that basis. First of all, do you think that we can have two-sided flexibility if the DWP continue to pursue quite a work-first approach, which requires people who are unemployed and a low income to take any job in a lot of circumstances? So people who are claiming universal credit don't actually have that much control over the sorts of jobs they do. And then second of all, how optimistic are you about prospects of real investment in our training programs and retraining? So we know that in the UK, spending on labour market policies is quite low compared to other nations in the OECD, and I think the support in job centres has been characterised by a lot of people as quite poor. Sharon Wright at University of Glasgow calls it a bargain basement approach to employability. And so, when we see these announcements, are you optimistic, or are the challenges to come, do you think? Daniel, do you want to go first?
I'll go first. So first on active labour market policies, certainly so far they've not been particularly effective, and also the point that Fabian was making about the national retraining scheme, in its current form it's unlikely to address these issues, but a development of it that is based upon the idea of improving employability within the workforce, because the need for such a policy is much greater now. And the development of the national retraining scheme has been iterative to this so far, and now an expansion of that could really have great benefits. But certainly in terms of optimism, I'm not so sure I have that there isn't a great deal of evidence to suggest that there's suddenly going to be some very effective active labour market policies introduced. But since there was a commitment to this national retraining scheme, it suggests that there is some foundation. It's not starting from nowhere at all. So that gives me a small amount of optimism there. Then in terms of the benefit system and the work first approach, I think if there were other aspects that is also added to what comes with this work. So when we're looking at the jobs guarantee scheme that's being proposed to the Scottish Government, where you also have access to training, I think it's these interactions, combinations of particular interventions. If there's benefit schemes that involve some work, but also involve some training and some routes to progression, I think this would be beneficial. So it's how you can combine these multiple interventions that may allow there to be effective interventions within what we currently have. The development may be based upon joining things up a bit more.
Yeah, so I guess to throw some optimism into the discussion, these are unprecedented times. So who, like 6 months ago, we would have never have thought a furlough scheme was impossible, and it definitely does signal a slightly more Scandinavian flavour to our economy. So maybe we will see more investment in skills and training. A lot of it probably will depend on just how big the unemployment level rises, and that there's definitely like there's various takes on just how severe it will be, and whether it might even be some commentators saying, for example, that what most of the macroeconomists are forecasting might be conservative. But there's also, there's related to that, there's a huge challenge for how we do on-the-job learning. So, for example, in an age of social distancing, it's going to be much more harder to train people in colleges where lots of the learning is very hands-on and can't be done virtually. And then also when it comes to taking people on as apprentices, it may prove increasingly difficult to do that under some kind of social distancing measures. So I'm not sure what the innovation will look like there, but it feels like some innovation will be needed. On universal credit, we saw conditionality removed from UC, and part of that, but it's back already. But when that did happen, there was a kind of, for me, it was like, wow, maybe this will be the new normal. Again, a lot of it might depend on just how much unemployment rises, because if it rises to some of the levels that are being projected, I don't see how they have the administrative capacity to deliver that quite hands-on, trying to find people job kind of support. So that's one thing to think about. Like, if unemployment does rise to the level, we've had really record low level of unemployment for a long time now, and the capacity within these organisations is quite low to rapidly scale up. But also, I think one of the key arguments we would make around UBI and unconditionality is that it increases workers' bargaining power, so it allows people to look for opportunities that might be better in the long term and have that kind of, at least for them, provide them with some kind of beneficial experiences rather than just be any job at any cost.
Great, thanks both. So maybe keep an eye on the Scandinavian examples and the good work that's going on in Scotland to try and inform best practice there, perhaps. So we do have a question, very exciting, which relates to this idea of upskilling as well. So do you have a sense of how employers would respond to suggested interventions such as portable benefits and upskilling employees? So
I think definitely on the kind of upskilling employees question, which is maybe you're asking about personal learning accounts, I definitely think there is a appetite for this kind of model, this more universal approach to training credits. So the way that we envision personal learning accounts being implemented is that it would involve some kind of reform of the apprenticeship levy. So employers are already paying into this, and there's so many complaints that it's just not flexible enough. So largely the way we've kind of designed this policy is to address that need from employers, as well as providing a service which is more universal and is, it's for workers. But in many ways, I think you've got potentially it is a much better use of the apprenticeship levy, which currently is a redistributive mechanism where big businesses pay in and smaller businesses also benefit from that. But smaller businesses are other businesses that would probably benefit from a much more flexible system. And then on portable benefits, this is obviously this is a harder one to ask, because you've got potentially in the gig economy where this is a much liver debate. There have been lots of positive noises. So I believe probably some years ago now, like Will Shu, the CEO of Deliveroo, said that if you work with us 35 hours a week, you should get the same benefits as an employee. And if you work for us 7 hours, you shouldn't get the same. So you know, they're kind of committed to that idea of like giving employees or giving workers some relative protections. I think the challenge comes in about how it's interpreted in relation to the separate debate about employment status classification, which gig platforms particularly will, you know, they will not want to go down that road. So in some ways, this is a helpful third way for them, but it's not supposed to kind of sidestep that question of employment status. Great.
Daniel, do you have anything that you want to come in with on that point?
Not a great deal. That was a very comprehensive answer, but I think just one aspect, if the incentives are there for employers to engage, then that's far more likely. So the design of these interventions to provide employers with the incentive to engage will also determine their success.
Great, thank you. Well, the questions are coming in thick and fast now, so I'll try and whiz through a few in the remaining 9 minutes that we have left. So here's one from Kerry Hughes. I'm interested in the implications of the findings on insecure work and inequalities for wider spatial inequalities in the UK. Do you have any evidence on whether these are clustered in particular types of labour markets or areas?
Okay, so up in Aberdeen, we recently produced a report with the Scottish Trade Unions Congress that looked at the particular challenges that the oil and gas sector in Aberdeen or the northeast of Scotland suffers. And in addition to the 2008 financial crisis, there was also a downturn in 2014 that was quite severe. And there's a will to move from a system of oil and gas exploration to a movement towards renewables. And if there were policies there that allowed that transition to take place, that would be beneficial, because what we find is that insecurity within the northeast of Scotland, within the oil, driven by the oil and gas sector, is actually particularly acute, and then this has impacts across a lot of the rest of the economy. So depending upon the structure of the industrial structure of regions and the particular challenges that those industries face at any time, then you have some spatial variation in the levels of insecurity.
We've not done too much research on the specific spatial implications yet. I think we at a broader regional level, the differences never appear that huge. This is something, you know, we'd be really interested in exploring. So if other people are interested in working on that, on collaborating about that, would be interested in discussing it. We have looked at some data on the impacts of coronavirus locally, and that obviously has quite a big variation depending on what industries are located in specific areas. So in a previous analysis, we found rural areas would be quite hard hit.
Great, thank you both. So the next question is about management style. Would the management style need to change in a post-COVID-19 context, as that is considered to be one of the major causes of work-related stress? If yes, then what would be an appropriate management style?
Yeah, so the Business in the Community report from 2019 that I mentioned earlier, that highlighted an understanding of the financial well-being amongst the workforce. Another one of the major factors that they identified was also management style, and in particular, bullying by management is impacting negatively on the mental health of employees. And I mean, it's a disgraceful situation to find that. And there's an awful lot of focus on management practices and productivity and the use of key performance indicators and things like that. But actually, at a more sort of human level, there might need to be some greater understanding amongst management about the mental health issues within their workforce. And there was actually recently a paper in the Lancet Psychiatry that showed the benefits of training management in an understanding of mental health issues. But then another aspect of this, the CIPD, when they produced their report on workplace well-being, they found that middle management are in fact those under greatest strain, those whose mental health suffers the most. So this pressure on middle management may actually contribute to a bullying culture that then affects other employees. So we also have to consider improving the mental health of the middle management, but certainly greater training and greater awareness of mental health issues within their workforce could greatly improve management practices.
I think this is an incredibly hard question to answer, because I think the answer is obviously yes, but we have no idea of what works, because, you know, any blog on how to manage a remote team that was written before the pandemic is completely useless, because this situation, at least for workers in the knowledge economy who are working remotely, this kind of remote working is very different to what remote working was like before. So there's huge challenges, and unless if you had it completely figured out before and you were already fully remote, then you've probably brought with you all of the distractions of the office online, and so it's a very different kind of. So yeah, we're gonna have to think about that, but don't think we have the answers yet.
Great, thanks Shweta Sharma for a very interesting but challenging question to end on. This is my terrible job where I have to bring the session to a close to make sure we finish on time. But can I just thank both of our speakers and also the audience for such an engaging discussion on this timely topic. A recording of the webinar will be available for you to listen back to and share from Monday via the PIN website, which was on the slide at the beginning of the session. And they will also be providing updates via Twitter. So that's at Productivity Northwest, or NW, sorry. The PIN team will be sending you a short feedback form shortly in the next couple of days, and we'll be really grateful if you could spare a few minutes just to complete this. The next webinar is this time next week, and it will focus on how will the effects of COVID-19 on macroeconomic demand and supply affect firm level productivity. So that will be next Thursday, 23rd of July, again 12 till 1, with Professor Gary Dimsky at the University of Leeds and Professor Dom Webber at the University of Sheffield. Registrations for that webinar will be open next Monday, but if you're super keen and want to sign up before then, please email productivity@sheffield.ac.uk. So thanks very much everyone again for a great session, and I hope you enjoy the rest of your day.